Hi, my name is Marianne and I'm your nurse today and I'll be performing a physical assessment. How are you doing today? Good. First, I'm going to start by inspecting your head, okay? Just looking at your hairline. Very good. Good. And now I'm going to, sorry, I didn't mean to mess up your hair. Now I'm going to ask you to raise your eyebrows to crease your forehead for me. Very good. And puff out your cheeks. And smile, not showing your teeth. And frown. Very good. And now I'm going to ask you to try to close your eyes against me, the resistance. Good. Very good. Good. And now I'm going to ask you to push your head against my hand. Good. Good. Okay. I'm going to feel now for TMJ of the jaw. I'm going to check your jaw, so I'm going to ask you to open and close your mouth. Again. Again. Okay, good. No clicking. Was that tender at all? Okay, good. Now we're going to move down and check your neck. I'm going to ask you to bend forward and then extend your neck back, all the way back. Good. And then if you could turn to the left, you could bring your neck back to normal and then turn left and right. Good. Very good. And now look back at me. Now I'm just going to feel for the lymph nodes of the neck, okay? You let me know if anything feels tender. Okay. So far, so good. No swollen lymph nodes. Good. Just gonna feel in here. Okay, very good. And now I'm going to check for your trachea and your thyroid, okay? Just going to feel here. Okay, good. Midline. I'm going to feel for the thyroid. Okay, very good. And now I'm going to ask you just to lay back because I'm just going to look at the jugular vein to make sure that it's all excellent. I'm going to ask you just to turn your head to me. Looks good. And now the other way. Looks good. Great. Now if you could just sit back up for me. Excellent. I'm going to ask you to shrug your shoulders. Up and down. Up and down. Very good. And now squeeze my fingers. Just checking for some strength. Good. Very good. And now I'm going to move into checking your eyes and your ears, nose, and mouth, okay? So if you don't mind, I'm just going to look at the conjunctiva and the sclera, and they're pink and clear, looking good. And now I'm going to get my light, and I'm going to start examining your eyes, okay? I'm just going to come and look from the side at the cornea. Looks good. And now on this side, just look straight. If you could just look straight for me. Good. Good. Very good. And so now I'm going to use this Q-tip and I'm just going to come in from the side to your eye and just to check for sensitivity. Good. Very good. That's exactly what you were supposed to do. Good. Next, I'm going to ask you to just look over my shoulder. And now look at my finger. Good. Very good. And now I'm going to just check your pupils as well. Just look at me. Good. On the other side, just look at me. Excellent. Excellent. Pupils are equal, round, reactive to light, and accommodation. And now I'm going to just check the muscles of the eye. So if you could just follow my finger without moving your head, I'm just going to hold your chin in place. Excellent. Other side. Good, very good. And now I'm going to ask you to just look at me and let me know when you see my finger from the side.
See it.
Okay, good.
You see it.
Very good. And now if I had an otoscope, I would look into your eye. So we're just going to pretend, and I would look into the eye to see that the blood vessels were intact and to see that there was no edema or swelling, to make sure that there was a light reflex in both eyes and that everything was intact. Very good. Now next we're moving into checking your ears and to have an otoscope. So first we're just going to look at the ear, and then I'm going to look inside your ear. Okay?
Mm-hmm.
Okay. Technical difficulties here. Okay, here we go. Pull up and back and look. The ear canal is pink. Small hair is visible. The tympanic membrane is pearly gray. No bulging, no redness. Light reflex present. Now I'm going to look at the other ear. Pull up and back. No, just keep your head straight for me.
Sorry.
Yes, thank you. It's okay. Now look in. Canal once again is pink. Small hair is present. Tympanic membrane is pearly gray, no bulging, and light reflex present. Very good. Now I'm going to check for some hearing tests.
Okay.
First, I'm going to check for bone conduction versus air conduction. Okay, so I'm going to put this on. Let me know when you don't hear it anymore.
I don't hear it.
And now?
I don't hear it.
Okay. I'm going to check the other ear.
I don't hear it. I don't hear it.
Okay. In a normal test, if we had the correct tools, the air conduction would be twice as long as the bone conduction. Okay. Now I'm going to place this on the top of your head, and I want you to let me know if you hear it in the left ear, the right ear, or both ears. Okay.
Both.
That would be a normal finding, to hear in both ears. And now I'm going to check your hearing by whispering, but I'm going to ask you to take your finger and press on your right ear, and I'll whisper behind on the left side, and you let me know what you hear, and then we'll do the other side as well.
Red, blue, yellow.
Very good. Press on the left ear.
Black, white, gray.
Very good. Good job. And now I'm going to check your nose. First, I'm just going to look at your nose. Just look at me straight. And then I'm going to palpate the sinuses. Tell me if you feel any tenderness or discomfort.
No. Feels good.
Okay.
Same here.
Okay. Just going to look in your nose. Just tip your head back for me. No obstructions. Pink. No swelling. Septum looks midline. Okay, very good. Technical difficulties. Okay, and now I'm going to check your sense of smell. So I'm going to ask you to close your eyes. I'm going to have you smell something and just let me know what it smells like.
Smells like vanilla.
Very good. It is. It's vanilla. Okay, great. Next, I'm going to check your mouth. I'm going to put my gloves on though at this point because I'm going to have to look in there. But I'm going to ask you to open your mouth for me. Just 1 minute. Okay,
There's secrets on now.
not yet. Okay, as soon as you clean them. If you could just open your mouth and let me look at your teeth. Just show me your teeth. Very good. cheeks. Buccal mucosa. Let me look at your gums. Very good. Everything looks good. No swelling, no redness, no bruising. Okay. You can open your mouth and say Uvula's midline. Gag reflex is intact. No tonsils. Let me see. Open your mouth one more time. Say no tonsils present. Very good. Now if you could stick your tongue out for me and touch your nose and then touch your chin. And then just let me I'm going to take a hold of your tongue here and just look side to side. Make sure there's nothing to be concerned with. Okay, very good. It all looks good. Okay, next we're going to be listening to your heart. Okay, first I'm going to ask you actually to say, just let me feel for some thrills and heaves. Okay, just normal breathing. Okay, now I'm going to listen to some of your, with the bell of the stethoscope, I would be listening to the temple and the carotid. And then I'm just going to listen to the apical. Okay, now I'm going to listen to your heart. This would be the aortic, pulmonic, tricuspid. I would have to just go in and listen, Bree.
Okay.
Good? And apical. Good, very good. Heart sounds good. Now I'm just gonna check for some swelling in your extremities. If I could just take a look at your arms. Okay, looks good. Just, if you could just dangle your legs. I'm just going to feel for any kind of swelling, look for swelling, any edema, any pitting, which would indicate swelling. And it looks good. And now I'm going to feel for your pulses, okay? First I'm going to feel for carotid. Just keep your head still. Okay. Okay. And now the brachial. Side. Okay, and then the radial. Okay. And then I'm going to ask you to lay down so I can feel for the femoral. Okay. Okay, and then on this side. Okay, and then papadial. Okay. Okay. And then on this leg. Okay. And then. Very good. And now I'm going to move into checking your lungs. So I'm going to ask you to sit up for me. I'm just going to take a look at your chest and your back. And then I'm going to ask you to raise your arms for me so I can look on the sides. Very good. Good. And then now I'm going to ask you to say 99 again, because I'm just feeling for the vibrations.
99. 99. 99. 99. 99. 99.
Good. And now I'm going to listen. Just breathe normal. Okay, if you could raise your arms for me, just so I can listen. Okay, and on the other side. Okay. So listen here. You can put your arms on, yes, sorry. Okay, good. I'm just going to ask you to also, one more time, I'm just checking for vibrations again. If you could just say 99.
99. 99. 99. 99. 99. 99.
Good. Now I'm just going to check for kidney tenderness. Let me know if this hurts you.
Mm-mm. No.
Good. Very good. Next, I'm going to move into checking your abdomen. Do you have any complaints about anything?
No.
Any issues? Okay. If I could just have you lay down, if you don't mind. Okay. I'm just going to have to lift up your shirt to look. And I'm going to listen first. I'm just going to move these a little bit. Okay. Now I'm going to feel for the liver and the spleen, okay? I'm going to start by percussing, so I'm going to start from down here. And percuss for your liver. Okay. And then from here. And when you feel for dullness, that's when you've located the liver. Now I'm going to palpate for the liver. I'm going to feel for the liver. This might be a little uncomfortable. I'm going to ask you to take a deep breath, and I'm going to push down and feel for the liver. Okay? On the count of 3. 1, 2, 3. Good. And now I'm going to check for the spleen. Same thing. I'm going to ask you to just give me a chance to feel for that, okay? Okay? Good. Now I'm just going to also palpate in the rest of your abdomen, okay? I'm going to start off light, go a little deeper, and then a little deeper, okay? A little deeper. deeper. Is that hurting you?
No.
Good. Okay, good. Now I'm going to check, I'm going to do a test to check for gallbladder tenderness or any kind of uncomfortableness with the gallbladder. I'm just going to push down and you will let me know if it hurts, definitely. Okay, very good. And now I'm going to do a couple of tests to check for appendicitis or any abdominal inflammation and also your hip flexors, okay? So I'm gonna ask you to bend at the hip and bend at the knee and just allow me to move your leg. And if you have any discomfort, just let me know. Okay, good. Put your leg back out. I'm gonna have you just raise your leg a little bit and now do not allow me to push down, resist. Good, very good. So next I'm gonna have you sit up for me. We're gonna just check balance, coordination. Well, first we're gonna check your joints and range of motion, okay? So I'm gonna ask you to stand up. Put your arms out. Extend towards the back. And then bring them forward. And then palms up. Flex. Bring them back. Turn. Flex your wrists. And then flex up. I mean, extend and flex. And then rotate. And then if you could just rotate your arms for me. At the okay, good. At the shoulders. Very good. Yep. And then bring them back. And wiggle your fingers. Very good. Arms to the side. Now we're going to check your legs as well. So if you could kick out with your right leg, with your right leg, and then to the back, and then to the side, and then bend at the knee. Perfect. Left leg, kick out, kick back, to the side, and then bend at the knee, and then put it back down. Now if you could just pick up your foot, if you could just extend your foot, like flex your ankle up and extend, and then rotate, wiggle your toes. Perfect. Next foot, flex, extend, wiggle your toes, and then just rotate it in a circle. Very good. Now I'm just gonna check some reflexes for you. You can have a seat for that. So first I'm gonna check for the brachial. And then the radial. And then just relax your elbow. And then on this side. Just relax your arm. Good. And now I'm going to check the reflexes in your leg, but I'm going to ask you to hold your hands like this and pull. That'll help to give us a more accurate testing. And then okay, good, very good. I'm going to do one more test, neurological test on your foot. This helps. This is checking for coolness. So if you could just relax and allow me to flex your foot. Okay. Next, I'm going to flex the foot. Good. Now I'm going to do some neurological testing. I'm going to ask you to take your thumb and touch your fingers one by one. And then back. Good. And now I'm going to ask you to put your arms out. And then with your index finger, touch your nose. And then back and forth. And keep doing that. A little faster. Good. Very good. Now if you could put your hands on your thighs like that. And then I'm going to ask you to palm up. And then palms down. Palm up. Palms down. Good. Very good. Now I'm going to check for some sensation. Some sensation in your arms. So I'm gonna hold your arm like this and ask you to close your eyes and tell me if you feel 2 or 1.
2, 2, 1.
Good. And do it on the other arm. Okay.
2, 2, 1.
Okay. And now I'm going to take this cotton swab and I'm going to touch your face and with your eyes closed, and then you could just point to where you would feel that. Okay?
Mm-hmm.
Okay, good. Very good. One more test I'm going to do is similar to what we did before, but it would be sharp or dull. Okay? If you could close your eyes.
Sharp, sharp, dull, dull, sharp, sharp, dull, dull.
Good. Very good. Okay, so now I'm going to ask you to stand up and close your eyes and just stand for me. And then if you could take your arms and just put them out in front of you with your eyes closed for a moment. Okay, good, very good. Now if you could just sit for me. And if you could just take the heel of your foot, the heel of your right foot to your shin and move up and down. Good. And then opposite. Good, very good. Now we're just going to check your spine. You could just stand up for me. And what I'm going to ask you to do is I'm going to lift up your shirt if you don't mind. I'm going to ask you to bend forward as far as you can go, touch your toes if you can. And then slowly, slowly make your way up, keeping your back rounded. Good. Good. Very good. And now I just want to check the curvature of your back. If you could just turn to the side and allow me to just look. Good. Great. And now I'm going to ask you to walk towards me, heel to toe. Good. And on your tippy toes. And then on your heels. Good. Great. Good job. That concludes our physical assessment. Thank you.